It's now time for Global Insight, where we speak to experts from around the world on issues making headlines. More than 550 cases of monkeypox disease have been confirmed in 30 countries outside of the West and Central African nations where it is endemic, according to the World Health Organization. While experts say that the disease isn't as contagious as COVID-19, infecting less than one person upon exposure, the cases seem to have come out of nowhere, spiking in a few parts of the world. It hasn't yet made its way into South Korean borders, but with international travel set to pick up as countries loosen COVID-19 prevention measures, authorities here are still keeping a close eye on the trajectory of transmissions. We discuss today what we know about the outbreak so far and what the response should be. For this, we have joining us today Dr. Bharat PANKHANIA, Senior Clinical Lecturer at the University of Exeter Medical School, and Dr. Seung-taek, Virologist of Zoonotic Virus Lab at the Institut Pasteur, Korea. A very warm welcome to you both. And Dr. PANKHANIA, thank you so much for joining us at very early hours in the UK. We really appreciate it. And well, first off, there seem to be two major strains of monkeypox, the West African variety and the Central African variety. So could you tell us about their characteristics and, of course, which one is more dangerous?
So they're both part of the pox family of viruses. The only difference is that the Central African clade, in other words, the version that originates from Central Africa, appears to cause more severe disease and more fatalities compared to the West African variety, clade we call it, which is also disease-causing and also harmful, but less so than the Central African version.
And Dr. Kim, well, we don't have the virus here in South Korea yet, but what kind of patterns or trends have you noticed in the monkeypox spike in the UK, US and Europe?
Well, first of all, I have to say this is not the first outbreak outside of the Africa, but this spreading of this monkeypox is quite unusual. I mean, compared to some past experience. And secondly, just many confirmed cases are actually just being found among the men who have sex with men. And then, but this does not necessarily mean that this virus is transmitted by sexually. And then, but I think most experts agree that still just the virus is transmitted by very close contact. And then thirdly, the viral sequences that are actually just being the sequences right now from the some outbreaks in the outside of Africa, and all the sequences are very similar, which actually suggests that maybe this outbreak actually just came from the one single infection source.
And well, Dr. PANKHANIA, you've said that the monkeypox outbreak shouldn't escalate into a pandemic like we saw with COVID-19. And the World Health Organization, its officials seem to now be echoing this remark that you made. But still, what kind of caution should we still be taking, and what kind of prevention measures do you think need to be prepared by health officials?
So there is a lot that we still need to learn about monkeypox. And whilst I am confident that it was not a new pandemic, we need to be aware, we need to be doing our surveillance, we need to do our contact tracing and management of both cases and contacts of the case. So let's start from the beginning first, which is, whilst this is not going to become a new pandemic, something new has happened. So there was an animal reservoir for this virus, and maybe now we have a new animal reservoir as yet unknown for this virus, and that has transmitted from the animal place to humans and then from humans to humans. So it is both a zoonotic and a human-to-human communicable infection. What we need to do is manage it and control it. This is similar to smallpox, not a severe disease causing, and we also have effective vaccines, and we also have pretty good antivirals. So what should we do? One, don't get infected. Number two, we need to look harder and deeper as to what could be a new animal reservoir for this virus. With every case, we identify their contacts, remove the contact from circulation for 21 days, maybe also give them a vaccination to prevent the illness, and manage it by identifying the case, identifying the contacts, and managing both of them. And finally, don't mess around with the wild animals from where we keep on getting these new infections.
And Dr. Kim, well, South Korea's health authorities, they've placed monkeypox in the second level of contagious diseases under the country's system. So what does this really mean, and what are the chances of monkeypox infiltrating the country?
Well, first of all, the some second level of just a contagious disease in Korea actually just include the some COVID-19, and then measles, and then tuberculosis, and then hepatitis A, things like that. So what that means is actually that we actually have to report the actually confirmed cases, and also isolate the some confirmed the patient within 24 hours of just confirming that this monkeypox. So this is kind of what we have to do in terms of public health measures. And then in terms of chances of monkeypox just infiltrating the country, well, we are in some global, the period. By just using any air travel, any just infectious disease can be actually just travel just within the 24 hours since the onset of any infection in any part of the world.
And Dr. Kim, another question for you. If there is a monkeypox outbreak here in South Korea, then how rapidly do you think it would spread? And are hospitals well equipped to respond?
Well, first of all, this monkeypox is not like the SARS-CoV-2, and the SARS-CoV-2 is generally transmitted by the airborne transmission or just droplet transmission. But this actually monkeypox actually requires some close contact, so transmission potential is quite low compared to the SARS-CoV-2. In other words, and also the sort of just the basic reproduction number, R lot is just less than 1. So I think in terms of our capacity to deal with the monkeypox in Korea, is that first of all, I have to say the Korean government, the KDCA, has the capacity to diagnose this monkeypox. And according to some press release from the company, that the Korean, also one of some private Korean company also developed the diagnosis system for this monkeypox.
And Dr. PANKHANIA, well, it's the monkeypox is supposed to be an endemic in some African countries, and well, does that mean that monkeypox will fade away or die out eventually? And really, how should we reduce transmissions, particularly at this time where many countries are enjoying summer festivities, holding all sorts of concerts outdoors and festivals?
So as we have an animal reservoir for this virus, it is very, very difficult to eliminate it from planet Earth, because how do you do it? You could immunize the world's population, but there is still an animal reservoir. So the thing to do is to stop it going from one animal reservoir, as we don't know which one it is, most probably rats or similar, to another animal reservoir, which we still don't know, and keep it contained in the animal kingdom. Then the second line comes in, which is, are we going to get more of this? Well, if we don't get infected, then there is no virus and we can continue with our lives as normal. So what we do need to do is have that awareness, looking out for it, monitoring it, removing people from circulation, and immunizing people. I'm afraid we cannot eliminate it, but what we can do is subdue it, control it, and keep it under control like we have done for the last 40, 50 years.
And Dr. Kim, well, once you do get monkeypox, though, how does a person recover from it? What kind of medical attention should they seek?
Well, as of now, the monkeypox is sort of just endemic, especially some West Africa, and those countries and those areas. Most of the measures that being taken right now is mostly just a supportive care, and not using any just specific antivirals. But I think there are some things that we can use in terms of just preventing, also some treating the monkeypox. And then for the in terms of the antivirals, now the Cidofovir and then Cidofovir, this is kind of just the antiviral that were actually used for cytomegalovirus infection. And then another drug is Tecovirimat, and then this is also just one of the drug that you can actually try. And then lastly, some vaccinia, just immunoglobulin. And then these three are actually just sort of just suggested just the treatment options by the CDC and others. And that there are because the monkeypox is not really just common, especially in the Western countries, and that there are not many actually just the cases. I mean, in terms of so there are some actually limited information on the some clinical efficacy of those just antiviral options. But these are supposed to be just to work against this monkeypox. And in terms of just the vaccine, in Korea, according to the KDCA, we have I think just plenty of just the vaccine doses. And then since this monkeypox, we are actually considering the vaccination. Considering vaccination, not for the whole just the Korean population, but we are actually concerned about some sort of just a ring vaccination, which is actually focusing on the high risk groups. So then and considering the some number of just the population in Korea, we have actually just more than 30 million doses available right now. This is about just this was actually developed as a smallpox vaccination, but this smallpox vaccine just should work against the monkeypox as well.
And Dr. PANKHANIA, with COVID, we had a lot of concerns about long COVID and the prolonged symptoms that stay with you long after the virus, long after you seem to have recovered. And well, are there such long-term side effects or conditions that result from having monkeypox?
No, we are not aware of this. However, unfortunately, some people can have scarring where they have those macule, papule, pustules, those little boils that develop on the periphery, which is face and arms. So if they get secondarily infected, you can be left with scarring. So as far as we know, we're not aware of what we would call long-term COVID-like symptoms. In other words, generally left unwell after the infection. But there is, unfortunately, can be, in some people, scarring after that infection.
And Dr. PANKHANIA, while public health advisors like yourself are reassuring people that monkeypox won't be the new COVID-19, there still seems to be a very heightened sense of fear, not helped by some media sensationalism. And well, what then should be the public messaging on monkeypox at this point?
Well, it is always good to inform, educate, and advise the public. An educated public is a better able public to deal with the news and what they need to do. And then politically, what we do need is this action to control it, especially from the animal interface to the human interface. What is going on? Have we got a new animal reservoir? Is this new animal reservoir then infecting humans? And we should, of course, ramp up the manufacture of the vaccines in case it is needed in several places for several interest groups, like our colleague has just mentioned. So at the moment, we keep calm, but we need to be watchful. We need to find out what this animal reservoir is and then do something about it. In the meantime, also cooperate. That no infection stays in one country. So we need to cooperate globally to control something that can become a global issue.
My last question to you, Dr. Kim, what kind of global coordination or cooperation do you hope to see in terms of keeping these diseases contained? That's to you, Dr. Kim.
Oh, yeah, basically, I think in terms of this kind of some global just outbreak, we need some coordination, especially we need to just identify or the source, the origin of these monkeypox just outbreak, and also we need share the sequence information. And then so one of the actually just concerns among the scientists is that, well, there are still just things that are not unknown at this moment, and then although the chances are pretty small, but then we are also concerned about whether there is any kind of just a mutation just occurring this monkeypox just about the viruses. So that in that kind of the question, we need some coordination among the the scientists along the entire global globe. Yeah.
Well, I'm afraid we'll have to leave the discussion here for today, but that was Dr. Bharat PANKHANIA, Senior Clinical Lecturer at the University of Exeter Medical School. Thank you again so much for joining us at such inconvenient hours in England. And Dr. Kim Seung-taek, Virologist of the Zoonotic Virus Lab at the Institut, Pasteur, Korea. Thank you so much, both of you, for joining us this morning.
Thank you.
Thank you.